Hello, this is Graham Brown, Senior Vice President with NextGen Healthcare and a Principal with NextGen Advisors. Welcome to our weekly podcast focusing on significant issues in healthcare. On March 25th, the Biden administration announced that Health and Human Services, Health Resources and Services Administration would award $6.1 billion in supplemental funding grants to the nation's 1,376 federally qualified health centers. I'm joined by my colleagues Chris Emper, NextGen Healthcare's Government Affairs Advisor, and Dr. Marty Lustick, also a Principal with NextGen Advisors, to discuss the implications and opportunities associated with this unprecedented funding. Chris, let's begin by having you outline some of the key provisions Health and Human Services and the White House announced.
Sure. Thanks, Graham. Great to be with you guys again today. So, first of all, the most important thing to understand is that this is money coming from the overall $1.9 trillion American Rescue Plan Act, which is the President Biden's big COVID aid relief law that was, passed a few weeks ago. $7.6 billion from that $1.9 trillion was allocated towards community health centers. Out of that $7.6 billion, this award is seeing $6.1 billion specifically designated to community health centers for the fiscal year 2021, which on the federal fiscal year calendar runs through September 30th of this 2021 year, spread evenly across the 1,376, as you mentioned, community health centers, which stretches across all 50 states and the District of Columbia. So the money is being apportioned based on the size of the health centers, based on a formula that HRSA has used in the past to divvy up these grants. And as part of this Section 330 federal funding formula and the grant program for community health centers, the community health centers, are involved in every year. So the bulk of their federal funding, and it involves their designation as a community health center itself. So there's a little bit of a formula that HRSA has applied based on the size of the center. You have a base value of $500,000 per center, so everyone's getting at least $500,000 plus $125 per patient, plus uninsured patients that are seen by the centers. And this is all calculated based on previous year's UDS reports, which are the reports that community health centers have to provide each year. Overall, if you spread the $6.1 billion across the nearly 1,400 health centers, you're looking at an average award of $4.4 million per center. And the larger centers are looking at awards of over 20 and even over 30, approaching $40 million. So pretty big awards overall, and just in terms of dollar figures. And to put that into context, the average annual revenue for a community health center is approximately $20 million per year. So you're looking at a supplemental additional one-time award of about 20% of their annual budget that's coming this year. So for these centers that are, safety center healthcare providers, this is a huge shot in the arm and a really historic opportunity. It's the largest ever one-time single award. And, to put it further into context, each year community health centers receive $5.6 billion in standard Section 330 grant funding. So this more than doubles their annual funding and their previous funding for FY 2021. So those are just a couple of the numbers to help put this into some perspective of how big the awards are and what centers can expect coming out of this.
Wow. These are really huge dollars and quite an unprecedented investment in FQHCs. So really interesting to learn about this in greater detail. One of the things that stuck out was the focus of these funds. So the American Rescue Plan Act and her saying it's a word release, they talk a little bit about how the funds are intended to be used. And they quote from the release, to respond to and mitigate the spread of COVID-19 and enhance healthcare services and infrastructure. So that's a pretty broad statement. And Marty, I'd be interested to learn from you. How do you think FQHCs could use these grants to serve the patients in their care? And also, why is this kind of investment so important?
Yeah, to me, this is a really interesting issue, and it's also related to conversations that we've had with leaders of various FQHCs over the last year. We heard many stories of how they engaged with their community to be a part of the public health response to COVID-19, whether it was going out and testing utility workers in the field or providing within their communities. And so I look at this investment and the way they describe it, and it's really an opportunity for the FQHCs as a whole to step up and elevate the level of public health infrastructure in all of the communities that they serve across the country. They already have stepped into that space, and by doing things like all of the preparation, promotion, distribution, administration, tracking of the vaccines. This will help them to build the capabilities to do that, but those are capabilities that will going forward will position them to respond to other health crises that might occur in their communities. And so this combination of being responsive to the immediate issue, but actually building capabilities that are really going to strengthen the health, both the healthcare and the public health infrastructure of their communities, I think is a great opportunity for them.
Chris, the FQHCs are really given considerable flexibility in how these grants can be used. What do you think some of the other priorities are for FQHCs that they might want to direct these funds to support?
Yeah, so it's very interesting with this grant, and a little bit different than a lot of folks maybe thought when the law was, signed, and there was some language in the law about the direction of where this $7.6 billion might have gone. In writing the award and in the release from HRSA, they said not only is it for COVID, but it's also, as you read from that quote, and for anything that's going to enhance healthcare services and infrastructure. So really, I think the proper way to be thinking about this, and HRSA has listed a pretty detailed list of activities and expenses that will qualify as being allowed uses or quote unquote allowable uses of the funds. But you're looking at a pretty broad swath of things beyond just COVID-19. So things such as staffing. You can use these to either, hire more people or to bump up the pay that you were looking to do before of existing clinical and non-clinical staff members. Software, looking at that infrastructure from a technology standpoint, electronic health records are included, either the purchase or the upgrade, all sorts of digital software tools included, patient outreach capabilities, telehealth functionality, both software and hardware, remote patient monitoring, really looking at all of the things that community health centers have been focused on in the last few years and potentially have been exploring, investing and building to the future, even looking prior to COVID. Those things are in play here and are allowable uses of the funds. One other note is that the physical infrastructure, so building space and kind of changing the physical offices that community health centers have, you are allowed to spend money on that, but only up to $500,000. And HRSA has actually said that there's going to be a supplemental $1 billion. And remember, that's out of the $7.6 billion. So that kind of gets you closer to that number when you account for 6.1, distributed evenly across all the community health centers to enhance their physical infrastructure. So the government has noted that community health centers have grown, so rapidly over the course of the last 10 years and are now serving about 30 million patients nationally. And to keep up with that, not only do you need, the digital infrastructure and staffing support, but, physical infrastructure. But that's kind of a minor use and only some qualifications around how you can use it in this particular grant. And, one last point that I think is relevant when you think about how to spend this money, the performance period. And with federal grants, it's a very complex process for anyone who's ever been involved in it. You have to fill out all sorts of forms and designate and dictate how you're going to spend the money and compare it against your budgeting before and after. For this grant, they're going to allow a performance period backdated to January of 2020, and that's in relation to COVID. So any expenses or costs incurred going back to January of 2020 through 2 years now, 2 years into the future, so March of 2023. So January 2020 to March 2023, any expenses that have actually been incurred as to now, looking at future projected expenses incurred through March 2023. So it's not just even though it's a one-time award, they are looking at it over the performance period of a couple years, which, is a significant point to keep in mind here.
So a comment on that, because I think the points you made, Chris, about how the money can be used in all of the software and other infrastructure. One of the concerns that I have about the way this is structured is that knowing that staffing has always been a challenge for FQHCs, and that they've been challenged to compete with, for example, academic medical centers and even private providers to get high quality staff and to keep staff. If they use this money for that, even though it lasts more than a year, it still is time limited. And so what happens at the end of that? And I'm wondering if, given the amount of the and the flexibility, will they be able to put some services in place that might generate the kind of ongoing income that would help support staffing needs in the long term? More laboratory capabilities, other capabilities that they can potentially generate revenue that also improve care, but that will support those staffing issues in the long term. I don't know if you have thoughts on that,
Marty. And I think that exactly those type of considerations are what the nation's community health centers are contemplating right now as they think about how to allocate these funds. And it's a unique opportunity where you have this one-time funding, but with the performance period that only goes through 2 years in the future, you don't want to set yourself up with a cliff like that. Mm-hmm. And I think certainly with, the provider burden, overwhelming concerns across the country with physicians, and especially in community health centers where in some cases you're dealing with some very challenging and very sick patient populations. Anything you could do to build up that infrastructure to, put more time back into the clinicians or the physicians that make their life a little bit easier would be a wise use of those funds in the next 2 years.
Yeah.
Marty, do you have a sense then, given that and given your conversations that we've been having with FQHC leadership over the past year on, how they might be trying to prioritize some of these funds? Do you have a sense based on those conversations that there are certain gaps and certain needs that really need to be invested in, or is this a time to transform the practice and position it for the future?
I think those are going to be very local decisions. From the conversations that we've had, for the larger organizations that have already some strength in their infrastructure, that haven't been sort of bootstrapped day to day, they've gotten a little bit beyond that. I think this is a huge opportunity for them to look at these funds strategically and really invest in transformational work. I'm worried that the smaller organizations that probably need to do that the most are the most stressed by what's gone on the last year and are going to need a lot of help and support in figuring out how to use these funds to their greatest advantage in the long term and not just resort to, putting Band-Aids on all the issues that are there right now.
Chris, help our listeners understand a little bit about the administration of these funds. The FQHCs are going to need to submit a plan, assumedly, on how they want to use these funds, but who do they submit that to, and what's the timing associated with it?
Sure. So this grant program follows the same process that community health centers use for their annual Section 330 grant awards from HRSA. So it's a process familiar to all the community health centers. And there's an online system from HRSA called the Electronic Handbooks, or EHBs, where they can actually go in and they see their award and they see all the documents and application pages they need to fill out. Unfortunately, like all grant awards and everything we do at the government, it is something that requires a lot of documentation, a lot of paperwork, and specifically for community health centers, as they're familiar with, through past years of filling out these applications and submitting documentation for these grants, they need to have pretty detailed budget and cost accounting for not only how they're going to spend these funds, but also for their practice in general in their business, how they're spending other funds. So, and one thing that HRSA has made clear in making these awards is that because it's this, record large amount of money, and, there will be some scrutiny around how these funds will be spent, they've urged the community health centers to, play by the rules, fill out your applications with the expectation that an audit will be coming on the back end, and that you have everything, all of your I's dotted and T's crossed, and everything kind of filled out. The application period is opened on April 1st and ends May 31st. So it's just 60 days here. As we stand here now, mid-April, you're looking at a month and a half. But of course, if you're looking to, use these funds in a particular way, you want to get that in well ahead of the May 31st deadline. And then beyond May 31st, depending on how HRSA approves or disapproves or, handles the application process, you'll be looking at having to submit quarterly progress reports around the grant, and then, having all sorts of detailed record-keeping requirements as is standard for other federal grants. Mm-hmm. So it's a little bit of a tedious process, unfortunately, but not surprisingly to anyone in the space based on how, previous grants have been handed out. And I think one of the unique things here is it's different in that they've opened up the application to all of these allowable uses of funds that most HRSA grants and other federal grants are not intended for. Usually they specify that, these funds are for this specific purpose, and you have to, meet their narrow window of what to use the funds for. And here they're just kind of opening it up and saying community health centers are different across the country. They're having different needs in response to COVID, depending on whether they're rural or urban or what the other care infrastructure and, healthcare service ability is in the area they're in, and providing this flexibility to the centers. So I'd say it's a very unique and a rather exciting time in the community health center world as a result of that.
It's going to be a busy 60-day window for these FQHCs. Assumedly, if they get, say, $1 million grant, they need to account for the full $1 million of how they intend to utilize those funds. So they may have some ideas top of mind, but filling in that paperwork to work with vendors, look at recruiting new services, benchmarking pricing, thinking about any capital infrastructure. They got to get pricing and costs on all of those things, put it into a budget. So there's a lot of work for these organizations to undertake in a short window. Thankfully, it's a process they've seen before, and there's no new burden in that regard, but certainly a lot of paperwork to get accomplished in the next little window here. We talked a little bit about how transformational this may or may not be. I'd be interested, just on a kind of higher level, what do you think this announcement tells us about the Biden administration's goals in terms of healthcare delivery? Marty, do you want to start with that?
Yeah, I think they're clearly leaning towards, not surprisingly, the government playing a much bigger role in healthcare going forward. This, in many ways, if it strengthens the FQHC infrastructure across the country, as it's likely to do given this infusion, it really creates a foundation for publicly funded primary care, behavioral health, dental services, that can actually, I think, drive the move towards a single payer more aggressively. So, I think it's consistent with Biden's message that they're not going to force single payer down anybody's throat, but they're certainly interested in making that option more attractive and more available to more people over time.
Chris, your thoughts?
I think first of all, it's a sort of a campaign promise that President Biden talked about during the campaign. He said specifically that he wanted to double federal funding for community health centers. And again, $5.6 billion was their annual, standard funding, and here's a supplemental one-time funding of $6.1 billion. So that's been achieved kind of off the bat here. But, looking back at the broader healthcare reform environment, so much of the discussion really over the last decade has focused on insurance coverage and expanding coverage through the Affordable Care Act exchanges, and now the debate around Medicaid and, potentially expanding Medicare as well. This is a whole other element of what the federal government does in terms of healthcare that's specifically focused on delivering healthcare services. So not coverage, but actually delivery of services. And I think the general population is very unaware of the concept of community health centers and just how much they've grown in the past decade. And the community health centers are caring for almost 30 million individuals, so about 10% of the population. And that if you're unable to pay for care, you don't have health insurance coverage, they cannot deny you care. It's a, sort of a free public service around healthcare delivery of services. And with these funds, depending on how centers choose to use them, whether it's through outreach in the community or expansion of, testing or delivery of COVID vaccines or expanding the physical infrastructure, I think you'll start to see a continued growth of community health centers in certain communities where they are not only the safety net provider, but quickly becoming the provider of choice. And I think that's something that perhaps has been a long time coming in many communities as these community health centers have grown. But I think that shift with the use of these funds in particular areas, may be a long-term legacy of the program and, really an inflection point to keep our eyes on.
Very interesting. Well, I imagine we will be revisiting this topic in the future. We know there's going to be quarterly reports on this and a lot of funds invested in the coming year. So it'll be interesting to see how those once-in-a-generation investments end up playing out in the field. Thank you, Dr. Marty Lustick and Chris Emper, for joining me today, and thanks to our listeners for tuning in. If you want to get a weekly reminder of each new podcast episode, please subscribe. This is Graham Brown with NextGen Healthcare. Thanks and have a great day.